Good morning and welcome to the world of chemistry. So, today we would like to present you on following topics. First one, the rational use of medicine. Second, prevention of drug addiction. Third, prevention of ozone layer depletion. And fourth, best other topics. Let's see a video on drug abuse.
Tonight we're going to focus on drug abuse and risks to our physical, mental, emotional, and social health. Please press pause now to set up your Cornell notes as shown on the screen. Let's start with drug abuse. Drug abuse is intentionally using drugs in a way that is unhealthy or illegal. So if someone is smoking marijuana or injecting heroin, both of which are illegal drugs, they are abusing drugs. Someone might also use legal drugs such as cough syrup for non-medicinal purposes. If that is the case, they are also abusing drugs. So in the past, we have talked about our health triangle in regards to physical health, social health, and mental emotional health. Each side of the triangle supports the other, and in order to be our healthiest, all three pieces should be represented when talking about our total health. Drug abuse for sure plays a role in our physical health. Drugs are especially dangerous for teens because our bodies and our brains are still developing. When under the influence, the brain and the nervous system do not work properly. Drugs may make a person feel nauseated, confused, and lose control of his or her ability to walk or talk. They can also cause memory loss, seizures, coma, or death. If a person becomes addicted to drugs and then tries to quit, they will also experience painful physical symptoms as they withdraw from the drug. We will talk about addiction and withdrawal later in this unit. While some people may use drugs to cope with uncomfortable feelings, drug users put their mental and emotional health at risk. Drug abuse weakens a person's ability to think and learn. Users often have low self-esteem and have trouble relating to others. Oftentimes they experience depression, anxiety, and confusion. While the user may feel they are using drugs to deal with their problems, they are actually creating more problems by using the drug. Finally, the biggest risk to our social health involves our relationship to family and friends. If we want to keep these relationships strong, we need to stay away from drugs. Drug abuse can harm relationships because users often have a difficult time dealing with others, even those closest to them when before that relationship wasn't a problem. Drug abuse changes a person's personality. Users may experience mood swings, which sometimes may lead to violence. As a result, relationships change because family and/or friends do not want to be around this person. In time, having or getting the drug becomes the most important thing in the abuser's life, not the strong relationships between family and friends. Now that we have gone over the definition of drug abuse and how it can affect our physical, mental, emotional, and social health, look over your notes and see if anything is missing. If so, please rewind and fill in the missing parts. Also, make sure you have recorded any questions or thoughts you might have based on tonight's video. We will talk about those first thing in class tomorrow. Please complete the checkpoint found on our website, and thanks again for tuning in. See you tomorrow.
Created using Powtoon.
Now, let's move on to the video on drug addiction. Here is the ozone layer depletion.
This is the ozone layer. It is a belt of naturally occurring ozone gases that sit miles above Earth and serves as a shield from the harmful radiation emitted by the sun. This radiation can cause skin cancer and cataracts in humans, harm animals, and also plants all across the globe. Without it, life on Earth would be almost nothing. Right now, though, it's depleting. The ozone layer is deteriorating due to the release of pollution containing the chemicals chlorine and bromine. Such deterioration allows large amounts of ultraviolet damaging B rays to reach Earth. Nothing is safe from this. If it affects one species in the food chain, it can affect and damage the entire world. Chlorofluorocarbons, CFCs, chemicals found mainly in spray aerosols heavily used for the past 50 years, are the primary culprits in ozone layer breakdown. When CFCs reach the upper atmosphere, they are exposed to ultraviolet rays, which cause them to break down into substances that include chlorine. The chlorine reacts with the oxygen atoms in ozone and rips apart the ozone molecule. According to the U.S. Environmental Protection Agency, one atom of chlorine can destroy more than 100,000 ozone molecules. Antarctica was an early victim of ozone destruction. This region's low temperatures speed up the conversion of CFCs to chlorine. Now, there's a frequently referenced hole, or thinned out layer where radiation can beam through over the continent. Its melting ice caps pose risk to the entire planet. If this occurred over an even more populous continent, then it would surely have a devastating effect. The life cycles of plants would change, causing disruptions in food webs and ecosystems worldwide. Oceans will be hit hard as well. The most basic microscopic organisms, such as plankton, may not be able to survive. If that happened, it would mean that all of the other animals that are above plankton in the food chain would also die out. Other biomes, such as forests and deserts, will also be greatly harmed. The planet's climate could also be affected by depletion of the ozone layer. Wind patterns could change, resulting in severe climatic changes throughout the world. The damage so far is already done. It's not reversible, but it is preventable. By using less products that contain CFCs, we can help control the level of depletion itself. Also, by pushing lawmakers to pass legislation and rules in chemical use and atmospheric research, we can ensure that we as a people are doing the right thing. Together, we can make sure this world is that much better place.
And the world will live as one.
What a drug does to our body. Let's see a review.
Enteral medications are broken down within the GI tract and absorbed into the bloodstream, where they are carried directly to the liver, allowing the liver to act on the medication before it is distributed. This is called the first pass effect. The degree varies, but any drug not given by some form of injection will always have a bioavailability of less than 100%. Some substances, such as insulin, are broken down in the GI tract into a non-therapeutic substance and therefore cannot be given enterally. During first pass, the liver chemically processes the drug into active and inactive metabolites. The active metabolites of some drugs cause prolonged duration of activity. For instance, the effects of diazepam can last for weeks or months. The ratio of active and inactive metabolites affect the bioavailability of the drug. This is the primary reason that enteral medications of the same dose have less effect than if given parenterally. For example, morphine given as tablets requires a significantly higher dose for effective analgesia than morphine given intravenously or by intramuscular injections. The first pass effect may be low, moderate, or high, depending on the drug. Absorption of enteral medications is also affected by factors in the GI tract itself. Enteric-coated medications may remain in the stomach long enough for the coating to dissolve if taken with a large volume of food. Acid-sensitive drugs taken on an empty stomach may be rendered ineffective. Gastric acids affect absorption, and little is known regarding the effects of either the short-term acid reducers, such as ranitidine, Zantac, and famotidine, Pepcid, or the longer-acting proton pump inhibitors, such as omeprazole, Prilosec. The rate of intestinal motility varies significantly from individual to individual and is affected by activity, age, diet, overall health, and medications that slow or stimulate intestinal function. Biorhythms affect both intestinal motility and gastric acid levels, so the time of day when the medication is administered can have direct effects on drug absorption and drug tolerance. People who receive chemotherapeutic drugs in the morning often report less GI side effects than if they receive them in the afternoon. Another factor that affects medication absorption is age. The aging process slows intestinal motility and can also decrease absorption. This may be further complicated by the fact that aging can increase or decrease sensitivity to various chemical substances. And the chemical attributes of the medication itself affect the rate of absorption. These include acid sensitivity and interactions with foods that may increase, decrease, or alter their effects. The chemical components of medications can be affected by the presence of other medications. The more medications an individual is receiving, the greater the likelihood of an adverse interaction, such as a chemical change in the drug or drugs that increases or decreases the rate of absorption. Alterations to the bowel, such as bariatric surgery and bowel resection, decrease the intestinal surface area, directly decreasing the rate of absorption. Finally, vigorous activity decreases absorption by shunting blood away from the GI tract to support the heart and muscles. Regular participation in sports or training activities may require adjustment in the time of administration of medications. Now we'll focus on drugs given by parenteral routes. These medications don't experience the first pass effect and are 100% available as they enter the bloodstream.
Thank you, Women, all for watching all these videos. Thank you.